Hi, this lecture video addresses urinary tract infection. Urinary tract infection, or it's commonly referred to in a healthcare setting as a UTI. It is an infection involving one or more components of the urinary tract. And then specifically under the umbrella of urinary tract infection, there are kind of four other types of inflammatory processes that are often related to infection. And one of them is urethritis, and that is an inflammation of the urethra. Then there's prostatitis. That's an inflammation of the prostate gland, so that would clearly only be present in men because women don't have prostates. And then there is cystitis, which is inflammation of the urinary bladder. And then pyelonephritis is inflammation of the kidney parenchyma, which is a fancy word for tissue, so the kidney tissue, and also the renal pelvis. So urinary tract infections can be bacterial, viral, or fungal. The large majority of UTIs are bacterial in nature, and then more specifically, most UTIs are caused by E. coli, that specific microorganism or type of bacteria. So urinary tract infections are more common in women, and that is because women have a shorter urethra, and the urethra is located close to the anus. So the colonization of bacteria coming from the GI tract can easily get into the urinary tract of women. Other possible causes would be related to defects that can cause obstructions structurally within the urinary tract. Pathogens enter the urinary tract from surrounding perineal tissue. That's, essentially one cause. Urinary catheters definitely put patients at an increased risk for urinary tract infection. That is often due to healthcare providers not using proper technique when they insert urinary catheters, so not, strictly observing sterile technique in that situation. And then also if a client has a urinary catheter and it's not cared for properly, like not cleaned daily and their perineal area is not cleaned regularly. Another possible cause is vesicoureteral reflux. That's a condition in which the urine moves from the bladder back toward the kidney. And that can be common in children who develop pyelonephritis. It's also seen in adults when their bladder outflow is obstructed, so something is not permitting urine to be released from the body, then this backflow can occur. And then another potential cause is renal scarring, so scarring within the kidney tissue as a result of hydronephrosis. And we talked about hydronephrosis in the renal calculi video lecture. So nursing assessment is going to include, as part of your health history, their history of current illness. So, when did it start? What symptoms are you having? Tell me more about what's going on. So GU symptoms, and then pain and any other symptoms. You're going to assess for risk factors. So diet and fluid intake is another risk factor. We haven't talked about the risk factors yet, but we'll get to those in a moment. And then lifestyle choices. So if they have proper hygiene, would be an important discussion, because if they don't, that increases their risk of UTI. And then if they've had a previous risk of UTI, because they would be more at risk if they have had UTIs in the past. And then your physical exam is going to include general appearance, vital signs. You're going to assess their abdomen, specifically their urinary system, genitourinary system. What does their urine look like? Does it have a foul odor? and then assess for CVA tenderness. So, risk factors. So, women are at higher risk. We talked about that. They have a shorter urethra. And then also related to those things listed there, so incorrect wiping. So, women need to wipe from front to back after they urinate, but many women don't do that. They wipe from back to front, and that just pulls bacteria from their GI tract into the area of their urethra, or their urethra, and that would greatly increase their risk of UTI. Also, sexual activity increases their risk, use of spermicidal agents, diaphragm use, and then the use of scented soaps. Men, the things that increase their risk would be benign prostatic hyperplasia, so that causes an enlarged prostate, and if you think about urine flow issues related to that, that would increase their risk. If they're uncircumcised, if they have anal intercourse, or also increases their risk. And then also UTIs in men are pretty uncommon. So if a man presents with a UTI, it would really prompt some further diagnostic testing, because you might be wondering then, do they have something further going on, like cancer of the bladder or somewhere in their urinary tract that's causing, a breach of integrity of their urinary tract where that bacteria can get in and cause infection. So urinary stasis increases the risk of infection. So if urine is just not flowing freely through the urinary tract and out the body, maybe if a patient is holding their urine, would be not recommended because it increases their risk, or if there's some obstruction that's causing urinary stasis. A neurogenic bladder, that's where someone really can't empty their bladder on their own, that increases their risk. Tumors can cause an increased risk. We talked about that. Kidney stones increase their risk. Talked about that in the renal calculi lecture, so I'll refer you to that. Catheters, we already talked about why that increases their risk. Older adults are at an increased risk. They have a decreased immune system. They also are more likely to have, incontinence of urine and stool, and that increases the risk of UTI. Diabetes. Patients with diabetes are at an increased risk for really any type of infection. And then bladder irritants increase the risk, as well as a urinary tract surgery or procedure. I talked about that in the renal calculi PowerPoint. And then diarrhea increases the risk because that can introduce GI bacteria into the urinary tract. Okay, so I've got the clinical manifestations listed here. I'm not going to read them all to you. Just know that older adults could have just really vague symptoms, or they can even be asymptomatic. They can also not necessarily have fever and might even have a lower than normal temperature, and this is older adults, as I said. And then catheter-associated UTIs can also be asymptomatic. So appropriate diagnostic testing is a urinalysis. There's information about that on the next slide. A nitrite dipstick, so essentially if they're nitrite positive, that would be an indication that they have a UTI. A urine culture and sensitivity, so that's done to identify the specific bacteria or microorganism that's present in the urine, and realistically the provider would want to know what antibiotic is going to effectively treat that. I talked about that. Actually, I will be talking about that further in the infection and inflammation lecture video. Just know also that any type of culture, whether it's a urine culture, blood culture, wound culture, typically takes 48 to 72 hours. So those results will not be back right away. So realistically, what it looks like is the provider's not going to hold their antibiotic therapy until the culture comes back. They're going to start them on an antibiotic that treats the bacteria that most commonly causes UTIs, which is E. coli. And then when they get the results of that culture, if they find that E. coli is not causing the UTI, then they'll change the antibiotic to something that effectively will address the microorganism that's been identified. So that's why cultures are done. A CBC would be done because, again, you're looking for the elevated white blood cell count. Elevated white blood cells indicate infection. They could also have an elevated absolute neutrophil count, or ANC. I've got the normals listed there for you. And an elevated procalcitonin could be present as well. They could have an elevated CRP and an elevated ESR, and I've got all the data there for you on that slide. So when you're analyzing a urinalysis, let me see if I can make this bigger. You're looking for these things listed here. So if I'm using my little pen here, so the usual range slide, or part of this slide, this is what you expect to see when your patient doesn't have a urinary tract. So this area, these are the indicators of infection here, right? So, bacteria that's present indicates UTI positive, leukocyte esterase, white blood cell count greater than 10 realistically, nitrite positive would indicate UTI. Red blood cells could be present because if someone has a UTI, they've probably got a lot of inflammation, and that can cause bleeding. Epithelial cells are essentially skin cells. And so really, if you have a lot of epithelial cells present in their urinalysis sample, then that indicates, if it's more than 5 epithelial cells present, that indicates that they really did not properly obtain that urine sample, because there shouldn't be a lot of skin cells in there, because they would need to clean their perineal area before they urinate. So that's what epithelial cells indicate. And then pH, it realistically could be high if someone has a UTI. So that is what you would be looking at in your client's UTI, or in your client's urinalysis. So diagnostic testing, so they might have these procedures done. So an IVP, that's again where they start an IV and they inject dye to analyze the internal structures of the urinary tract. A voiding cystourethropy, that's a big long word. That involves instilling contrast medium into the bladder and then using x-rays to assess the bladder and other urinary tract structures. A cystoscopy is really where they insert that scope into the urethra and up into the bladder and ureter, and they assess the structures of the urinary tract. A manual pelvic or prostate exam, so that's where the physician or other provider would examine the client's pelvic area for abnormalities or structural issues. And then a renal and bladder ultrasound, that's again where they're using sound waves to visualize, either the kidney or the bladder to see if there are any abnormalities. And then a DMSA scintigraphy. That is used to detect pyelonephritis, which is a kidney infection, and also renal scarring. Okay, so collaboration for these clients. So managing pain, facilitating effective urinary elimination, so not holding their urine. Realistically, they want to increase their fluid intake to try to flush out their urinary tract. So either increased oral or IV fluids if they have an IV. Client education, so talk to them about their risk factors for UTI and how to minimize those, or eliminate those. Talked about increased fluid intake. They need to, void regularly. Talking about personal hygiene, educating female clients about wiping from front to back. And then if your client is given an antibiotic to take it home, it's important to tell them to take the entire course of their antibiotic therapy. So take it until it's completely done. They should also try to take it at the same time each day, and they should try not to miss any doses of it. Educating about early manifestations of urinary tract infection and to seek medical treatment promptly. Maintain optimal immune system function. So you want to avoid them from getting other infections or another urinary tract infection in the future. Talked about the importance of completing prescribed treatment. Minimize the risk of UTI when an indwelling urinary catheter is necessary. So proper care of their catheter and their perineal area is important there. So these are antibiotics that you might see your client on. Cipro's a pretty common one, and that affects bacterial replication and DNA repair. It kills susceptible bacteria. It may cause nausea, vomiting, and diarrhea as a side effect. It's important that that be taken with food. And that's a fluoroquinolone. And then a sulfonamide. A common one is TMP, SMZ, and also Bactrim. Those inhibit bacterial metabolism of folic acid. They kill susceptible bacteria. They also may cause nausea and vomiting. It should be administered orally with a full glass of water and used cautiously in clients with pre-existing renal disease because it can cause some kidney issues. When I say it may cause nausea and vomiting, that's a potential side effect. That's a potential side effect of almost every antibiotic. And then urinary antiseptics. So also antibiotics is another one is nitrofurantoin or macrodantin is the trade name. It interferes with bacterial enzymes. It kills susceptible bacteria. May cause nausea, vomiting, anorexia, or dark urine. They need to take that with food or milk. And frequent UTIs may be treated with antibiotics prophylactically. That means that they might give someone an antibiotic to prevent them from getting them in the future. So there's an issue with that, really, that I talk more about in the infection and inflammation lecture. So please listen to that lecture. So antibiotic use can also cause opportunistic infections. So that is an infection that occurs more often in clients who have a weakened immune system. So the reason antibiotics can cause an opportunistic infection is because antibiotics can kind of wipe out the normal flora of bacteria present in the GI tract. So the GI tract has bacteria in it that's supposed to be there to help the body function properly. And if that bacteria is, if some of that bacteria is killed by this antibiotic that's being used for whatever infection, then that can increase the risk of, other bacteria from invading the GI tract and causing infections such as C. diff or Clostridium difficile. Okay, so other medications that could be prescribed. Pyridium is a pretty common one. It's a urinary analgesic, so essentially that treats their urinary tract pain related to their UTI. Definitely diminishes their discomfort related to it. Here's an important thing to educate your client about related to this medication. A normal side effect is that it causes their urine color to become bright orange. So if you don't tell your client about that, they're going to be, probably pretty concerned when they see that happening. And this medication should be discontinued when pain or discomfort has resolved. It's taken orally. So then other analgesics and antipyretics that can be used, so that would be for pain and fever, are NSAIDs. Those are the non-steroidal anti-inflammatory drugs that help to decrease inflammation. They also reduce fever and they help to improve pain. They essentially, ibuprofen is one of them. It inhibits prostaglandin synthesis. It should be used cautiously in patients with renal or hepatic diseases because it can cause some dysfunction there. And these NSAIDs can cause gastric irritation, possibly gastric ulcers, or even GI bleeding. So it's really important that they take these with food. They can also cause nausea and vomiting as a potential side effect. And then a non-opioid analgesic is acetaminophen or Tylenol. And that does not reduce inflammation, but it does help to decrease pain and it can reduce fever. It's contraindicated in clients with severe hepatic impairment or active liver disease because, again, it can damage those organs. And it does not typically cause adverse effects. So, dosing is important. Even though those are over-the-counter medications, it's important to make sure that the client is not taking more than the recommended dose at a time, and even over a 24-hour period, because more than the recommended dose can certainly lead to, the potential to damage some of these organs that I just discussed. Nursing intervention, so you want to manage their pain, provide client education. We really talked about that. I have another slide about that here after this one. Facilitate effective urinary elimination. We talked about that, and not holding their urine, increasing fluid intake. And then you want to promote effective health maintenance. So ultimately we want to prevent further infection. So they need to take their antibiotics. Hand washing is really important, and meticulous perineal and catheter care is important. And this is appropriate patient teaching that came straight out of your book. I'm not going to read all of this to you, but I would recommend that you are familiar with this information. These are appropriate to help your client, resolve their UTI and also to decrease the risk of future UTIs. And that is the end of this presentation. Thanks for watching.